Hi, I'm Lauren Masi, Doctor of Physical Therapy and Board Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director here at Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about treating vertigo with physical therapy. So what is vertigo? Vertigo, by definition, is the sensation that the room is spinning. Not necessarily what you're feeling within your body, but literally if you were to stay still, that the room around you is spinning. Some people might also even notice or be able to identify a sensation of their eyes twitching in their head, and that's called nystagmus. Now, I have a lot of patients who come in and they might tell me that they have vertigo, and upon further discussion, I find out, no, they're more reporting that they're frequently falling, or they're tripping or stumbling, or that they're dizzy. Now, can those be descriptions of how they're feeling due to other balance disorders? Of course, but by definition, that is not exactly vertigo. So in physical therapy, we do a very thorough assessment to get to the root cause of what might be causing your unsteadiness, your dizziness, or even possibly your vertigo. So when you come in, I often will start by explaining what is balance. So in our bodies, there are three main systems that contribute to our body knowing where we are, and that includes the inner ear and the crystals that are in our inner ear called otoliths. It also includes our visual system and proprioception, which is knowing where our body is in space. Now we have proprioceptive nerve endings in all of the joints in our body. So that gives us feedback to tell us whether we're standing on a sideways hill, if one of our joints feels more compression on one side or we're leaning one way or the other. And proprioception, your vision, and those crystals in your inner ear all need to tell your brain the same thing so that our body can figure out where are we, and are we in balance or out of balance. So during a physical therapy assessment, when you come in, not only am I going to do that subjective discussion to hear what your symptoms are, but I'm going to put you through tests where I'm going to challenge your visual system, do some eye tracking things. I might have you try to balance on one foot and then maybe even on unstable surfaces. Our vestibular system, one of those three systems that I was talking about, has to do with the canals and the crystals that are in our inner ear. Here's a model of what that looks like, but it's really on a very, very microscopic level. All of these different canals have fluid that normally travels in them and little hair cells. And as we move our head through the world, the fluid whooshes past those hair cells, and those hair cells tell our brain what direction we're moving in. Now we have little crystals that sit in here too, and those crystals are not intended to be moving, but sometimes, say after a fall or if you hit your head, a concussion type injury, some people might report vertigo. Also, as we age, those crystals kind of dehydrate and they break loose even faster. So I'm sure you've heard me say in some prior vlogs, drink water. It's very important. Hydration plays a part even in this vestibular system. So again, when you're in for your evaluation, if I am suspecting that you have vertigo due to these crystals moving around, we're going to then, one of the treatments for that is to take you through very specific maneuvers to try to put those crystals back in the appropriate canal. That includes the physical therapist actually helping you through some movements, and then if and when appropriate, we can teach you how to do those maneuvers at home. One thing I do caution people is you can go on the internet and find everything nowadays, right? So I have a lot of patients who come in and they say, oh, I looked up this maneuver and I just did it at home and it's not getting better. And I do caution people because there are multiple canals. There are multiple different directions that these crystals can get thrown out of whack. You have this in one ear and the other ear. So there's a whole bunch of things that which might be why that one maneuver you tried on your own doesn't work. So that's where having the skill of a physical therapist really comes into play. If after my assessment I decide it's not coming from this vestibular system and those crystals, you could have what we call vestibular hypofunctioning, which for a lot of people just means you haven't challenged your vestibular system. Sometimes people might be afraid of falling, or maybe they've fallen before, and now they've kind of narrowed down their lifestyle. Maybe they're not walking on uneven surfaces anymore. They're not crossing that grassy field. So we tend to see this as people age, but it can happen in anyone, where if you aren't stimulating the nervous system in those ways, then if you do happen to step on something uneven, your body's reaction to that could be much more severe in making you feel unsteady and off balance or dizzy. The treatments for that sort of diagnosis, the vestibular hypofunction, is a graded exposure to those things. So your physical therapist is going to hone in on which balance exercises and activities you would need to do the most. We're going to set you up in a very safe environment to do them with us here and push those boundaries a little bit until you start to feel more comfortable and you're strong enough to withstand those challenges so that you feel much more comfortable in the world. So again, Physical therapy is an amazing, amazing help when it comes to vertigo, and a lot of people don't know that we can be the source. So if you need help with vertigo, unsteadiness, or dizziness, please reach out to us today for a complimentary consultation or to set up your evaluation. We want you to be safe in your daily life.